Hi, I'm Paul Gullickson, Communications Manager for the County of Sonoma, and this is our COVID update for Wednesday, December 2nd. We want to remind you that during this update, we will be taking questions from the public, and you're invited to submit those questions either by emailing them to us at publicaffairs@sonoma-county.org. Once again, that's publicaffairs, one word, at sonoma-county.org. Or you're invited to leave your question in the comments area of the Facebook Live page. We also ask those who will be joining us as panelists to speak loudly and slowly for the sake of our interpreters. So let's begin with, once again, a brief presentation by Dr. Sundari Mace, Health Officer for Sonoma County. Welcome, Dr. Mace.
Great, thank you so much, Paul, and thank you everybody for joining us today. Sonoma County remains in the purple tier within California's blueprint for a safer economy. Our rate of new daily cases per 100,000 is 8.8. This is well below the state average, which jumped to 30.2. Our testing positivity rate is 3.3%, which is also well below the state average of 6.4%. The state, once again, has not updated the equity metric for any of the counties. We continue to do better than much of the rest of the state at slowing the spread of the virus, which is advantageous as we enter what could be the most challenging phase of the pandemic. For 2 weeks in a row, our adjusted case rate has been less than 9, which is still above the 7 that we need to reach to be considered for the red tier, but it puts us far below the national average of 48.7. Though this data is encouraging, more importantly, it is a critical tool enabling us to see the whole picture of coronavirus in our community. This clearer view has been accomplished with our multi-pronged approach, including increased testing to reduce the overall community spread. In the past 5 weeks, the county has doubled the number of pop-up testing events. We are now offering testing at pop-up sites twice a day, each weekday, with some additional appointments available on weekends. The goal of these sites is to serve Sonoma County residents disproportionately impacted by the coronavirus, which tend to be those people living in the low socioeconomic census tracts and zip codes. Attendance has grown steadily at all locations since the end of October. Saturday pop-ups have been added in rotating locations to provide testing opportunities for our essential workers who have difficulty accessing the weekday testing sites. We encourage you to go to socoemergency.org/test. That's socoemergency.org/test, where you can find a map to see if you live in one of those areas that are targeted for the pop-up testing sites. You can also find a link online. We've also seen great success with the OptumServe testing sites, which are run in partnership with the state. OptumServe is operating 2 testing sites, one in North County at the Bluebird Community Center in Windsor, and one at the Santa Rosa Fairgrounds, which will be expanding on Monday to handle 50% more people. And we also have successfully advocated for opening a 3rd OptumServe testing location in Petaluma, which will open as early as next week. All of this will give us a capacity of more than 1,100 tests per day at OptumServe sites, which currently has a capacity of 660. Your response to our call for more testing has been even stronger than what we could have hoped for. Because of this high demand for appointments at our testing sites, particularly just before the Thanksgiving weekend, we know that some of you may have had difficulty making an appointment over our phone line. We have quickly worked to resolve that problem and have hired more operators to help with the demand. We also have created an online scheduler for pop-up testing that's available on the socoemergency.org website. As always, if you're wanting to get a test and have health insurance, we encourage you to first check with your healthcare provider to see if you can get tested through them. If that's not an option, please consider going to one of the OptumServe sites. Information on how to make an appointment is also on socoemergency.org/test. Increased testing has allowed us to identify cases more effectively. We're also offering resources to those who have tested positive so they can isolate with as little hardship as possible. Our partnership with the Cura Project and other grassroots community organizations has increased outreach to the most at-risk residents, providing resources and information about how to survive the economic and health consequences of COVID-19. As I mentioned earlier, though our numbers remain below state averages, transmission rates all around us are rising significantly. We've come together as a community to address challenges before. I know we can do it again. We need to protect the people who keep us healthy, those who keep us safe, those who put food on our table, and the many other essential workers who keep our communities running and safeguard our economy. If enough people make the right choices, such as wearing face coverings, avoiding social gatherings with non-household members, and washing up frequently, we will meet this challenge head on, as we have so many times before. Thank you. We now have a few minutes for questions from the community and the media.
Great. Thank you, Dr. Mace. I also want to remind everyone that we have with us today Dr. Kismet Baldwin, Sonoma County's Deputy Health Officer, Kate Pack, Health Program Manager of Sonoma County's Epidemiological Team, and Adam Radke, our Deputy County Counsel. And they also will be helping answer some of your questions for today. Let's start with a question from the public. There's been a lot of discussion about this, and Kathy asks straight out, will Sonoma County be shutting down as Governor Newsom has suggested? The governor has suggested a possible shelter at home order again. Dr. Mace, do you have thoughts on that?
Well, we will follow the governor's order if there's an order that comes out that states that we're putting more restrictions in place. So we will align with the governor's order because I think most of those restrictions are probably already in place here in our county anyhow. I don't know if Adam from County Council wants to add anything.
No.
Yeah, we have not. We're waiting day by day for any update from the governor, and he has not announced anything. He did say at his news conference on Monday that it could be coming in the next few days if the state continues on its trajectory of skyrocketing cases. So we'll wait and see what comes of that. So another question from Gina, the member of the public. She asks, will the county be updating the quarantine guidelines per the CDC update issued today? And I think that may have to do with the number of days of quarantine. I think that may be the reference.
Do you want me to answer this one? I've taken a quick review of the CDC's updated guidelines. I think at Public Health, we'd like to delve into it a little bit more, fully review it, and then make any necessary changes based on that. But it does currently continue the recommendations for 14 days of quarantine, but it gives the option for local and state health departments to tailor the quarantine periods based on needs, resources, things like that. So we'll take a more in-depth look and we'll update as we need to.
Yeah, it wasn't a hard and fast rule that CDC comes down with. It's mainly guidance, and depending on each of the counties and states, from what I understand. But thank you, Dr. Baldwin, for clarifying on that. Let's go to members of the media. I'm going to start with Julie Johnson from the Press Democrat. Julie.
Hi, thank you, everybody. This question is about vaccines. Now that there's so much promising information about vaccines on the way, I'm wondering, for the first batch of vaccines that might come this month, I'm wondering who in Sonoma County decides who gets the vaccine first, and how are they going to be distributed?
Good question, Julie. Really, most of our guidance, so in the end, the local health department would make that decision, but really we're taking all of our cues and our guidance from the state. The state will also has a prioritization and sub-prioritization of the vaccine and how to distribute it. And then they're also taking that from the Advisory Committee on Immunization Practices, what they put out earlier this week. So really we're taking our guidance from the state and may need to tweak it a little bit at the local health department level, but really we're going to follow that as closely as possible.
Is there a way to really simply describe the thinking at this point? I understand it's all probably somewhat hypothetical at this point. But like, you know, if you were describing for a fifth grader, like, well, you might go to, first we're going to prioritize people in acute healthcare settings, or do you collaborate with local clinics on that? Do you collaborate with employers on that? Like, how do you actually get it to the most vulnerable people first?
Well, there's actually many different levels of thinking to figure out how that prioritization is going to happen. And one is who's at highest risk, and trying to also maintain our workforce and our healthcare systems, because they're also the ones that are taking care of the people with COVID. And as you've seen recently, are becoming increasingly overwhelmed with our increased number of cases. Equity, that goes into it. Who's, again, at higher risk and maybe disproportionately affected by COVID. So there's many factors that go into deciding how it will be distributed and prioritized. And I know that the state has looked at all of those in the meetings that I participated in and listened in on. They take all of those factors into consideration. So, and there's more on top of that. It's not just those three, but it's a lot. It's multifactorial.
Sure. And a quick follow-up. Is that at the point where, Sonoma County's getting information like you will get X number of vaccines by X date? Doses.
Yes, they're starting to send out to counties how many doses they think we're going to receive on and when. So we're gonna discuss that a little more internally, and then once we have a firm number, we can let everyone know, and a date. Let everyone know.
Okay, thank you. Thanks.
Yeah, Julie, Adam, do you want to add a little bit more to that? I mean, I know that the CDC, the California Department of Public Health, that is going to be determining allocations for California counties. You want to talk a little bit more about that?
On the CDPH website, there's a link to vaccination planning, and there's further a link that has Q&A, and one of them is who will get the initial vaccines, given supplies are expected to be limited at first. And it says CDPH will determine allocations for California counties in accordance with the prioritization framework that is under development and will be additionally based on guidance from the federal government. CDPH and community-based organizations and other partners will review and incorporate national prioritization recommendations from the Federal Advisory Committee on Immunization Practices and the National Academy of Medicine to guide prioritization for California.
This is a super obvious question, you guys. I'm so sorry to take up so much time, but is it the kind of thing where you're going to be sort of facilitating getting the vaccine to clinics and doctors' offices, or is it the kind of thing that's going to be this government rollout where we'll go to, the public health lab to get a vaccine, for example? Do you know you get what I'm?
Yes.
I'm trying to illustrate for people what this might look like.
We are hoping to coordinate and collaborate with our community medical and health systems to the maximum extent. We really are going to work through that, and so that people would go to their providers, or health systems would immunize or vaccinate their own staff. That's the way we're going to work through the distribution and administration to the best of our abilities. If we can do that. But no one's going to come to the public health lab to get a vaccination.
I didn't think so, but thank you.
Yeah, but we'll be involved in the distribution process. So let's go to Mary Callahan. Mary?
Hi, can you hear me?
You're on. Yep.
Great, thank you. So I wanted to address the rather significant spike in new cases that was recorded last night, 343 new cases, and determine whether you guys had any intelligence as to whether that reflected, what that reflects in terms of any kind of catch up or lag time in reporting, or is that, do you think that that's reflecting the kind of surge that people are seeing around the country at this point?
Let me have Kate Pack speak to that. I think she'd probably be the best person.
Hi. I believe it's a combination of things. We are seeing a rise in cases. Looking at our own local data trends, looking with the 7-day lag, we're up to about 21 cases per 100,000 residents per day unadjusted. That bump, though, that you're referring with those cases, I think it's due to the increase, but also with the Thanksgiving holiday, some labs were closed. So the processing time as labs were moving through that data, it's possible that we're seeing a bump that's due to some of those lab processing times, maybe seeing a little bit of a spike in cases in terms of when they're reporting those cases. So it's likely a combination of factors. So both that we're seeing some increasing transmission, but also that we just did have that holiday last week, which may have made some cases bump up a little bit just due to lab issues.
Are you seeing any change in the level of asymptomatic individuals who are becoming infected, or any change in sort of the age range, or anything that would reflect a shift in how this is being transmitted?
No, we're seeing the majority of our cases are still, they seem to be among, we're starting to see a little bit more cases among younger individuals, but it's still that 18 to 44-year-old range where we see most of our cases. We've seen a little bit of an increase in terms of cases due to gatherings. That has bumped up a bit, particularly towards the earlier part of November. We're seeing that about 15% of our cases were due to gatherings. But other than that, our trends are, in terms of where we're seeing transmission coming from, are still holding pretty steady from what we've seen prior, with about 42% of the cases due to household transmission, still seeing workplace transmission. And then we do have a portion of our cases where the source of transmission is unknown, just because during that case interview, we don't have enough information provided to really be able to make a good determination of where that source of transmission is coming from, just because somebody may not recollect where they've been, or they may not feel comfortable sharing those details with the contact tracer or engaging with the contact tracer.
And in terms of hospital capacity, it looks like hospitalizations have increased a little bit, though we haven't reached where we were last summer. How concerned are you? That's obviously the hospital overwhelm is the biggest concern. How much hesitation do you guys have about that?
So yeah, our hospital, and Dr. Mays, feel free to jump in. Hospitalizations have increased from about 30 to 40. So as you said, we are not up to the levels that we were seeing, back earlier in the summer. But yeah, it is trending in the direction we wouldn't want. At this point, though, the hospitals are feeling comfortable in terms of their surge capacity to respond if those cases increase.
When the dashboard says that there are 3 ICU beds available, does the surge capacity include ICU beds?
So yeah, there's the ability to surge to expand ICU beds. When you see that there's 3 ICU beds remaining, that's 3 staffed ICU beds. Mm-hmm. So there's the capacity of hospitals to add additional beds and expand that capacity. It's just looking at when the dashboard's referring to staffed beds that that are ready to go right now, that hospitals can expand out the beds and capacity that they have to serve patients, given a little bit more time.
Thank you so very much.
Okay, let's go to a couple questions from our viewers in the community. Mike asks, when can I expect to see a vaccine here in Sonoma County? I have been in my house now for months. A lot of people feel. Dr. Mace, what do you think?
Well, I'm going to have Dr. Baldwin answer that since he's leading that effort.
Hi, we expect to receive the first allocation of vaccine sometime in December, probably maybe mid-December time. But when it will be available to the greater community, and I don't know, all of the details of each person's medical history and things like that, but there will be a prioritization. So basically, working through risks and benefits and things like that to decide who gets the vaccine when. And again, that's going to be set mainly by the state and by the CDC or the federal government. So we will get our first allotment sometime in December. When it becomes widely available to the community, probably in the new year, and I'm not sure when in the new year yet.
Yeah, and that first phase is likely to go to healthcare workers and long-term facility residents that are going to get that first batch. The other question is from Eileen, says, I see lots of people walking around with no masks in Petaluma. Doesn't the mandate require masks whenever you leave your home? Little confusion maybe about what the rules are about masks. Dr. Mace?
Yes, well, the masks are to be worn whenever you're indoors and with non-household members at any time. So if you're in a grocery store or different indoor location. However, outdoors, as long as you can socially distance for the 6 feet from other people who are non-household members, you can simply carry your mask. And if you feel like you are getting within that 6 feet of social distancing from non-household members, then you are to put on your mask.
Okay, great. Thank you for clarifying that. Let's go to Carrie Benefield. Carrie?
Thanks, everybody. Schools question. For the parents of the very small number of students who've been allowed back on campus and the tens of thousands of more whose children are still in distance learning, what do you feel like the imminent stay-at-home order, which is what it feels like, I think, from Newsom's office, what does it mean for them, both practically and just emotionally, for when these kids may go back to school?
Hey, let me turn that over to Adam, because I think he's the expert here on the orders.
Can you rephrase your question? I'm not sure I understand it.
I think it's mostly, it's two parts. There's a very small number of parents their kids are on campus, and what an imminent stay-at-home order from Gavin Newsom's office may mean for the kids who have been allowed to go back to school in a hybrid form. And then the second part would be for the thousands, tens of thousands more who haven't been allowed to go back to school. What should they read into this impending announcement about whether their kids are going to go back or not, and what the tea leaves say for them?
Yeah, I hear you. I think it's difficult because none of us have seen the language of a potential stay-at-home order, but certainly we've heard through the grapevines some things. I don't know whether the stay-at-home order will affect schools that have been authorized or were allowed to reopen. I don't know if the governor will be requiring them to close. I don't anticipate it, but I could be wrong. Again, that's reading the tea leaves with little to no knowledge, because I haven't seen anything from the governor's office just yet. As to schools that have not reopened, the state has been clear that they are recommending against any further school reopenings if the 7-day average of new cases per 100,000 is at 14 or above, which we currently are, which is why we notified schools that have applied for waivers, that the waiver application process is currently on hold.
And I mean, I guess just 30,000 foot view. I mean, is there any hope for these parents that, I mean, keep kind of getting bad news? Like we were heading towards what we thought was red. Now it looks like we're not. I mean, is there anything that they should see in this, in this waiting game about the viability of kids going back?
I mean, Dr. Mace, do you have anything to add? I don't really know if I have anything to add from a legal standpoint, but from a public health standpoint, do you have anything?
So you're talking about the emotional piece of kids potentially not going back to school in person?
Basically, and their parents kind of hearing yet another, punch in the gut of bad news. That, yes.
Yeah, no, I think that will be an issue that needs to be addressed. And we just need to, couch that in the most positive and accepting way possible that we may be headed that way. Luckily, we only have a very small handful of schools right now in the K through 6 grades that are open for in-person learning.
Okay. All right. Thanks very much.
Okay. Thank you. Let's go to Julie Johnson. You had a follow-up, Julie?
I do, yes. Thank you so much. And this is probably for Dr. Baldwin. To get to the most vulnerable people with vaccinations first, healthcare workers in acute settings, skilled nursing residents, how big is that population and how many doses, do you need, if in this first batch in December, you could wave a wand and get enough to cover that first tier population?
Another good question, Julie. We are getting those numbers in from our health care partners as we speak to find out who would be covered in the first tier, the first prioritization group, and what their numbers look like, and if we'll have enough vaccine for all of them. I doubt that we will. There's going to be, again, some sub-prioritization, and because it's just limited supply for the nation and for the state and for the counties. And so we don't have all of the numbers in yet. So I don't know how many of our 1A tier groups will be covered with our first allocation.
Okay. And is it correct to think, when the state says we're going to get X number of doses, that each person would get 2 of those?
So the plan is whatever we get for the first allocation is considered the first dose. They're not expecting us to split that allocation for the first and the second dose. That's considered, if say we got, I don't know, this is not what we're getting. I don't know. But if say we got 1,000, that's 1,000 doses, 1,000 first doses. And so
Gotcha.
They will send us another 1,000 to be the second dose.
Okay, understood.
We don't have
Thank you.
Yeah.
Okay.
Great. Let's go to Carl Van Amberg. Carl?
Yeah. Hi, everybody. Wanted to ask a question, kind of circle back to the surge capacity. And on Monday, the governor made it pretty clear that ICU capacity was one of the key drivers of what he will do and when he will do it. And he pointed to figures that showed in Northern California in general and in the Bay Area specifically by sometime in January, models showed that ICU beds could be over capacity by then. So that just leads me to my question, are there any plans on the county side to stand up another surge facility like the one we saw at Sonoma State that was the focus of a lot of reporting, wasn't used thankfully, but is there any thought right now to doing something similar to that on a large scale?
We haven't really gone that route yet. We do have the alternate care sites, as you know, for isolation and quarantine, like hotel rooms at this point. But we haven't yet thought that we need to have the kind of surge capacity we had at Sonoma State for potentially the sicker patients in terms of the gyms and things, but it's something that as case numbers and rates go up around the state, it might be something we need to revisit with our hospital and clinic partners.
Just a quick follow-up to that, Doctor. The state said that they had, I think it was 11 or 13 possible surge centers that they could set up within 3 or 4 days, something like that. Have they told you that one of them might be a regional center for the North Bay, or has there been any word about that?
I'm not sure where they're going to be located, but I suspect they'll be regional and spread across the state.
Okay, thanks.
Okay, and Mary Callahan, you had a follow-up?
Yes, I'm curious. We're just a few days past Thanksgiving. There was a lot of travel that happened last week. And in general, that you have said, and have said even recently, that it takes a couple of weeks for that to be reflected in the caseload. Are you expecting it to go up? And if so, how much? Do you have any sense of that?
Kate, do you have an idea of this?
I think it's hard to predict how much it will go up. It's definitely something that we're monitoring closely in the contact tracing interviews and on our epidemiology team, looking through those case interviews and determining whether the exposure was due to a gathering that was related to Thanksgiving. We have seen, as I mentioned earlier, just gatherings in general. We've seen an increase in that recently. So it's definitely something that we'll be monitoring and can provide further information on as those case interviews begin to come in.
Thank you. And I'm so sorry to do this, but can someone quickly remind me the difference between unadjusted and adjusted case rate?
Sure. So unadjusted case rate just refers to so the state, if you look at the blueprint metrics, for example, the state shows our unadjusted case rate, but then they also want to give us credit for the increased testing that we're doing, because as we do more testing, we're going to find more cases. So what the state does is they look at our testing volume, and right now our testing volume is over 500 tests per 100,000 people in our population. That is, I believe, more than double than the state's average testing volume right now. And when you're over double the state's testing volume, what they do is basically cut your case rate in half, as when they're your unadjusted case rate. So they're applying a factor to adjust it. So it's basically multiplying the unadjusted case rate by 0.5. So you can more fairly compare it to other case rates. Yeah, so it factors in the amount of testing that you're doing, because they really want to encourage counties to be testing and finding cases and not penalize them for finding more cases through efficiently testing.
Okay.
Yeah.
Okay, thank you so much.
Okay, thanks, Mary. Let's go to one last question from Mike DeWald from KSRO. Mike, are you with us?
Thanks, Paul. Is there a capacity to the amount of contact tracing that can be done locally? I mean, is there a point where new cases exceeds the ability to effectively contact trace?
Yeah, that's a really good question. Certainly when we have, 300 some cases in a single day, there is going to be some delay, and we're going to do some triage. We do have an algorithm in place for trying to get to our cases and contacts quickly by just asking the most important questions up front, telling people to isolate and to quarantine, and then we can loop back with them afterwards to get further details about their, more specifics about symptomatology and work sites and all those kinds of things that we also need to know about. But we will find out whether they are part of a cluster up front.
Okay, thank you all. I need to wrap this up. I'd promised Dr. Baldwin and Dr. Mace that they have other meetings to go to today, but we want to thank everybody for your questions. We have some really good questions from the public today, and a few that I'm going to hold on to and we can address during our next community briefing. Once again, I want to thank Stuart and Sylvia, our producers today, as well as Gilbert and other members of our crew behind the scenes, including Jordy, our
This
Spanish interpreter,
408 at KSRO.
and
that is
Elizabeth,
the
our
daily
ASL
briefing
interpreter.
from Sonoma County
Most
Public
of
Health
all,
Officer Dr. Sonoma Mace on the.
Most of all, I wish to thank all our panelists. Dr. Baldwin, Kate Pack, Adam Radke, and especially Dr. Mace for being here today.